Welcome, future medical professionals. Today we delve into a fascinating and vital component of our blood plasma proteins. These are not just passive passengers in our circulation, they are incredibly active molecules. Think of them as the body's diligent workforce, constantly performing a multitude of critical tasks. From maintaining fluid balance to fighting off infections and helping our blood to clot, their importance cannot be overstated. Understanding plasma proteins is fundamental to grasping human physiology. They are complex macromolecules, primarily synthesized in the liver, and they form a significant portion of the plasma, the liquid component of blood. Their study offers profound insights into both health and disease. Before we explore their diverse functions, let's get acquainted with the key players and their normal concentrations. The major plasma proteins include albumin, globulins, and fibrinogen. For serum albumin, a normal value typically ranges from 3.5 to 5.0 grams per deciliter. Serum globulins, a more diverse group, usually measure between 2.0 to 3.5 grams per deciliter. Fibrinogen, crucial for blood clotting, is present in smaller amounts, generally 0.2 to 0.45 grams per deciliter. It's important to remember that these values can vary slightly depending on the laboratory and the specific assay used. These proteins collectively contribute to the overall health and homeostasis of the body, acting in concert to ensure our physiological systems run smoothly. A particularly useful clinical indicator derived from these values is the albumin/globulin ratio, often referred to as the Ag ratio. This is calculated by dividing the albumin concentration by the globulin concentration. Normally this ratio is greater than 1, typically ranging from 1.2 to 1.5 to 1. A reversed Ag ratio where globulins exceed albumin can signal various pathological conditions. For example, it might indicate chronic liver disease, as the liver's ability to synthesize albumin is impaired. Alternatively, it could point towards certain kidney diseases where albumin is excessively lost in the urine, or conditions involving increased globulin production, such as multiple myeloma or chronic inflammatory states. The Ag ratio, therefore, serves as a valuable, albeit non-specific, screening tool. It prompts clinicians to investigate further when abnormal. It reflects the delicate balance between these two major protein groups. Albumin is the most abundant plasma protein, and its primary role is maintaining oncotic pressure, which we will discuss later. Globulins, on the other hand, are a mixed group with functions ranging from immune defense to transport. An imbalance in their ratio can disrupt many physiological processes, highlighting the interconnectedness of these protein functions. Understanding these basic values and ratios is the first step in mastering the complex world of plasma proteins, a journey essential for every medical student. To study plasma proteins effectively, scientists and clinicians need methods to separate and quantify them. One of the oldest techniques is precipitation. This method involves adding substances that reduce the solubility of proteins, causing them to precipitate out of solution. Different proteins precipitate at different concentrations of the precipitating agent, allowing for a crude separation. For instance, salts like ammonium sulfate are commonly used. By gradually increasing the salt concentration, different protein fractions can be isolated. While not highly specific, it's a foundational technique that paved the way for more sophisticated methods, and it's still used for bulk protein purification in some applications. Salting out is a specific type of precipitation that relies on high salt concentrations. The salts compete with proteins for water molecules, effectively dehydrating the proteins and causing them to aggregate and precipitate. This is a gentle method that often preserves the biological activity of the proteins. Another classic approach is Cohn's fractional precipitation, developed during World War II. This method uses cold ethanol, pH adjustments, and temperature control to separate plasma into different fractions. It was crucial for isolating albumin for therapeutic use and also yields fractions rich in globulins and fibrinogen. It's a more controlled process than simple salting out, allowing for better separation of major protein groups. Modern laboratories predominantly use electrophoretic methods. Electrophoresis separates proteins based on their net electrical charge and size. When plasma or serum is placed on a support medium, like an agarose gel, and an electric current is applied, proteins migrate towards the electrode with the opposite charge. Albumin, being highly negatively charged, moves fastest towards the anode, followed by alpha-1, alpha-2, beta, and gamma globulins. This technique provides a characteristic pattern, and deviations from this pattern can indicate various diseases. It's a powerful diagnostic tool routinely used in clinical settings to identify abnormal protein levels or the presence of monoclonal proteins, as seen in multiple myeloma. Other advanced separation techniques include ultracentrifugation, which separates proteins based on their sedimentation rate under intense gravitational forces, largely determined by their molecular weight and shape. Gel filtration chromatography, also known as size exclusion chromatography, separates proteins based on their size. Smaller molecules enter the pores of the chromatography beads and are retarded, while larger molecules pass through more quickly. Finally, immunoelectrophoresis combines electrophoresis with immunological reactions. After electrophoretic separation, antibodies specific to certain proteins are allowed to diffuse into the gel, forming precipitation arcs where antigen-antibody reactions occur. This allows for the identification and quantification of specific proteins, offering high specificity. Plasma proteins possess distinct physical and chemical properties that dictate their functions. Their molecular weights vary considerably. Albumin, the smallest of the major plasma proteins, has a molecular weight of approximately 69,000 daltons. Globulins are a more heterogeneous group, with molecular weights ranging from around 90,000 daltons for some alpha and beta globulins up to nearly 1 million daltons for IgM and immunoglobulin. Fibrinogen is a large protein with a molecular weight of about 340,000 daltons. These differences in size and structure are crucial for their separation by methods like gel filtration and ultracentrifugation, and also influence their ability to cross capillary walls. One of the most critical properties of plasma proteins, particularly albumin, is their contribution to oncotic pressure, also known as colloid osmotic pressure. Because proteins are large molecules that do not easily cross capillary membranes, they exert an osmotic force that draws water into the capillaries from the interstitial fluid. Albumin accounts for about 80% of the total plasma oncotic pressure due to its high concentration and relatively small size, meaning more molecules per unit mass. This pressure is vital for maintaining fluid balance between the blood and tissues. A significant drop in plasma protein levels, especially albumin, can lead to edema, as fluid accumulates in the interstitial spaces. Plasma proteins also contribute to the specific gravity of blood, which is slightly higher than that of water, typically around 1.025 grams per milliliter for plasma itself. While electrolytes and other small solutes contribute to the overall osmotic pressure, proteins are key for the colloid osmotic pressure. Furthermore, plasma proteins act as buffers, helping to maintain the acid-base balance of the blood. Proteins contain amino acid residues that can accept or donate hydrogen ions, thus resisting changes in pH. Hemoglobin in red blood cells is a more significant buffer, but plasma proteins, particularly albumin, play a supportive role in maintaining blood pH within its narrow physiological range of 7.35 to 7.45. The origin of plasma proteins differs between embryonic and adult life. In the embryo, the mesenchymal cells, specifically those in the yolk sac and later the fetal liver, are the primary sites of plasma protein synthesis. As development progresses, the liver takes over as the principal site. In adults, the vast majority of albumin, fibrinogen, and most alpha and beta globulins are synthesized in the hepatocytes of the liver. The gamma globulins, which are immunoglobulins or antibodies, are a notable exception. These are produced by plasma cells, which are differentiated B lymphocytes found in lymphoid tissues throughout the body, such as lymph nodes, spleen, and bone marrow. The functions of plasma proteins are remarkably diverse, reflecting their complex nature. One of their most well-known roles is in coagulation, or blood clotting. Fibrinogen is the key protein here. When a blood vessel is injured, a cascade of enzymatic reactions involving various clotting factors, many of which are also plasma proteins, specifically beta-globulins, culminates in the conversion of soluble fibrinogen into insoluble fibrin threads. These threads form a mesh that traps blood cells, creating a clot that seals the injury and prevents excessive blood loss. Without fibrinogen and other coagulation factors, even minor injuries could be life-threatening, highlighting the critical nature of this protein system. Plasma proteins, particularly the gamma globulins or immunoglobulins, are central to the body's defense mechanisms. These antibodies are produced by plasma cells in response to specific antigens, such as bacteria, viruses, or other foreign substances. They bind to these antigens, neutralizing them or marking them for destruction by other components of the immune system, like phagocytic cells. This specific immune response is vital for protecting the body against infections and is the basis of immunity acquired through vaccination or prior exposure to a pathogen. Other proteins like complement components, beta-globulins, also play a role in innate and adaptive immunity by enhancing inflammation and direct lysis of pathogens. Many plasma proteins serve as transport molecules carrying various substances throughout the bloodstream that are otherwise insoluble in water or need to be delivered to specific tissues. Albumin is a major transport protein, binding to and transporting fatty acids, bilirubin, hormones like thyroid hormones and steroid hormones, and many drugs. Specific globulins also act as carriers. Transferrin transports iron, ceruloplasmin transports copper, and transcortin transports cortisol. Lipoproteins, which are complexes of proteins and lipids, are essential for transporting cholesterol and triglycerides. This transport function ensures that vital nutrients, hormones, and even waste products are efficiently moved around the body. As previously touched upon, the maintenance of osmotic pressure is a crucial function, predominantly carried out by albumin. The colloid osmotic pressure, or oncotic pressure, generated by plasma proteins, helps to retain fluid within the vascular compartment. This counteracts the hydrostatic pressure that tends to push fluid out of the capillaries into the interstitial spaces. A proper balance between these forces is essential for maintaining blood volume and preventing edema, which is the accumulation of excess fluid in the tissues. When albumin levels fall significantly, such as in liver disease or nephrotic syndrome, this balance is disrupted, leading to fluid leakage and tissue swelling. Beyond the major roles already discussed, plasma proteins contribute to several other vital physiological processes. They play a part in acid-base balance, acting as buffers due to their amphoteric nature, meaning they can accept or donate protons. This helps to stabilize the blood pH within its narrow physiological limits. Plasma proteins also influence blood viscosity. The concentration and types of proteins, particularly larger ones like fibrinogen and some globulins, contribute to the thickness or resistance to flow of blood. Increased levels of these proteins can raise blood viscosity, potentially impairing blood flow through smaller vessels and increasing the workload on the heart. The erythrocyte sedimentation rate, or ESR, is a common laboratory test influenced by plasma proteins. Red blood cells normally carry a negative charge, causing them to repel each other and remain suspended in plasma. However, certain plasma proteins, especially fibrinogen and immunoglobulins, can reduce this negative charge, promoting the aggregation of red blood cells into rouleau formations. These larger aggregates sediment more rapidly. An elevated ESR is often seen in inflammatory conditions, infections, and some cancers, where levels of these acute-phase proteins are increased. This contributes to the suspension stability of red blood cells. Alterations in plasma protein composition can destabilize this suspension. Plasma proteins are also involved in the production of trephone substances. These are substances believed to be derived from leukocytes and plasma that are thought to provide nutrition to tissue cells. While the exact nature and significance of trephone substances are still areas of research, Plasma proteins are considered to be a source material for these nutritive factors. Furthermore, plasma proteins can act as reserve proteins. During periods of protein deficiency or starvation, the body can break down plasma proteins, particularly albumin, to provide amino acids for the synthesis of other essential proteins or for energy. This acts as a temporary buffer against protein malnutrition. Plasmapheresis is a medical procedure where blood is drawn from a patient, the plasma is separated from the blood cells, and the blood cells are then returned to the patient, often with a replacement fluid like saline or albumin solution, or with treated plasma. Whipple's experiment in dogs demonstrated the importance of plasma proteins. He depleted plasma proteins through repeated plasmapheresis, and found that it took a considerable time and dietary protein intake to regenerate them, highlighting their physiological significance and the body's reliance on continuous synthesis. Clinically, therapeutic plasma exchange, or TPE, a form of plasmapheresis, is used to treat various autoimmune diseases like myasthenia gravis or Guillain-Barré syndrome by removing harmful autoantibodies or other pathogenic substances circulating in the patient's plasma. The levels of plasma proteins are not static. They can vary significantly under different physiological and pathological conditions. For instance, during pregnancy, there is typically a slight decrease in total plasma protein concentration, particularly albumin, due to hemodilution, which is an increase in plasma volume. Conversely, dehydration can lead to a relative increase in plasma protein concentration because the plasma volume is reduced. Newborn infants have lower total plasma protein levels compared to adults, particularly gamma globulins, as their immune system is still developing. These levels gradually increase throughout childhood, reaching adult values by adolescence. These are normal physiological variations. Pathological conditions, however, can cause more dramatic and clinically significant changes. Hypoproteinemia, or low plasma protein levels, can result from various causes. Malnutrition or malabsorption syndromes can lead to decreased protein intake or absorption, impairing synthesis. Severe liver disease, such as cirrhosis, significantly reduces the liver's capacity to synthesize albumin, fibrinogen, and other proteins. Kidney diseases like nephrotic syndrome cause excessive loss of protein, especially albumin, in the urine. Severe burns can also lead to significant protein loss through the damaged skin. Each of these conditions underscores the importance of proteins for overall health. Conversely, hyperproteinemia, or elevated plasma protein levels, can also occur. This is often seen in conditions characterized by increased production of specific proteins, particularly globulins. For example, chronic inflammatory diseases like rheumatoid arthritis or chronic infections can lead to a polyclonal increase in gamma globulins. Multiple myeloma, a cancer of plasma cells, results in a monoclonal increase in a specific immunoglobulin known as M protein. Dehydration, as mentioned, can cause a relative hyperproteinemia due to decreased plasma volume, but this is different from an actual overproduction of proteins. Analyzing these variations is key to diagnosing and managing underlying diseases. In summary, plasma proteins are far more than just simple constituents of blood. They are dynamic, multifunctional molecules essential for life. From maintaining fluid balance and transporting vital substances to defending against pathogens and enabling blood clotting, their roles are extensive and interconnected. Understanding their normal values, properties, origins, and the methods used to study them is fundamental for any medical student. As you continue your medical journey, you will frequently encounter situations where knowledge of plasma proteins is crucial for diagnosis and treatment. So keep exploring, keep learning, and appreciate the hidden marvels working tirelessly within our bloodstream every second of every day.